Hey guys, how's it going? Ulysses here once again with the Idg Hospice, and today's lesson is going to be on IDG and the importance of IDG. IDG stands for Interdisciplinary Group. Basically, this is everybody involved in the patient's care, from the medical director, social worker, DPCS, RN, case manager, LVN, HA, and anybody else that might be involved. We have these meetings every 2 weeks. These meetings are very important. This is where we sit at a round table and discuss every patient and their condition. We'd really appreciate it if you would join these IDG meetings, because as a care team, we're really interested in what you as a nurse has to say. And any input that you give us is very welcomed and very well appreciated. Remember guys, as far as nurses and staff and HAs and anybody in the care team, we need to make sure that everybody's on the same page and has the most updated info in order for us to provide that quality care that comes with the Idg Hospice. So we really encourage you to join these IDGs, give your input, give your suggestions. You know, there's a room full of nurses here to where you might learn something, or maybe you might learn on how to take care of a certain situation due to the other nurse's experience. You know, 10 heads are better than one. So sometimes, even us as nurses, we might not have the answer, or we're looking for some help. The good thing is we have a team here full of experienced nurses, doctors, the whole works, that have possibly been there, done that, to where they can give you some kind of advice or recommendation on how to take care of certain situations. This is what we do, guys. IDG is very important because the doctor gives new orders. There could be a possibility of maybe even a discharge from hospice for your patient due to the fact that we provided great care, we've got the medications on hand, delivered right on time, patient is increasing in their appetite, they've gained weight. So when we found the patient, they were in really bad shape. But thanks to our great care, they got back on track, they got a second chance at life, and they're doing better. This is where all of this is discussed, and we might need to discharge. Or, as a nurse, you might want to say, hey guys, at this point, I really think that we're only going once a week, but I think it's really important that we start doing twice a week visits, or maybe even suggest placement for the patient. Guys, this patient isn't doing so well. She's very weak. She actually keeps getting weaker. I would like to request maybe a visit from the social worker. Maybe we can go ahead and help place the patient somewhere where there's 24-hour, 7 days a week nursing care. Like I said, guys, the care team for that patient is very important, so we want to hear what you got to say. We want to hear what you recommend or what the patient is going through. You guys are the eyes and ears for the doctor, so the doctor needs to know. Besides your notes, the doctor needs to know exactly what's going on. And nobody can describe it better or explain it better than the people actually making the visits, right? So once again, we encourage you to join our IDG where the whole care team is present. Not only that, you get to talk to all of your coworkers and your colleagues, and not only is it informative, but it's also a learning experience. Believe me, I learned a lot of what I know from these IDGs, from hearing the doctor talk, from hearing how certain situations are handled, and you guys know knowledge is power. So with that being said, join us at IDG. If you have any questions, give us a call. You can also look up at IDG notes on your hospice MD as well and get a little idea of what's going on with the patient. But please guys, come on in. IDGs are handled through Zoom or Google Meets. They're every other week, and we're looking forward to seeing you guys there. Thank you very much for your time, and this is IDG lesson.